Hi, I'm Kitty Lamprecht and I am your physiotherapist. One of the advantages of doing a video is at least this way you will see what I look like. Because when you see me next time, I will be wearing a mask and you will be in high care after your operation. So I just want to give you some information about what to expect after the operation. So you are going to have a transforaminal interbody fusion. And what it sounds very technical. What it means is that where you have a disc in between the vertebral bodies, they are going to put something like a spacer. The spacer will facilitate bone growth so that the bodies of the vertebrae will fuse together. And that is what we call the anterior column, the fusion over the posterior column that we are going to do with screws that they put into the facet joints. I don't think, you need to memorize that. By your second day, I'll give you a program in a whole home pack. And I will explain it again, and I'll show you some pictures so that you can have a clearer idea. What is important to understand, however, is the spacer facilitates the fusion. So by the time that the operation is finished, there isn't a complete fusion. That takes time. So the bone needs to grow into it. And that is one of the goals of our treatment, is to make sure that there is not too much twisting and bending over that level, that you can have a proper fusion. It's one of the reasons why you're going to wear a brace for 6 to 8 weeks to help facilitate that. The other important thing is we must always remember that when we have a fusion or in a chain of joints, the level above is under quite a lot of pressure. So that disc we want to protect, to prevent it from going. So, and that is the second goal of the program. It's always aimed to try and protect the other discs too. And that will also be a long-term goal for you. But that is something that we will go over regularly. What is more important now is to understand what to expect when you wake up. So you are going to wake up in high care. You're going to be lying on your back. You will have a catheter in. So going to the toilet or using a bedpan is not necessary. You're going to feel that you have something around your calves that feels like they're pumping. And that is to help your circulation. Secondly, the first day in high care, it's quite important, and we want to manage your pain properly. So you will have what we call a personal controlled analgesic pump or PCA pump. It is something that you can push and that will give you some painkillers. When you wake up, the sisters will, when you're awake, they'll show you where it is and they'll put it in your hand, and you can push it whenever you really are in discomfort. What is important is that we need to remember that you can move your legs. You don't need to lie like a mummy and not move at all. So you can move your legs, and if it's comfortable, please do. You can pull them up. And you can also ask the nursing staff to turn you after about 4 hours. So you can be turned if that is comfortable. Sometimes patients find that their bums get really sore, and turning will then help. Another important thing is that you can sit up. So we want to lie flat, but eating and drinking is very difficult when you lie flat. So what is nice about the bed is the whole bed can be tilted so that you are slightly more up and yet you are straight. So by the time that you have breakfast, if you're ready to eat, then you can either ask them to turn you on your side or tilt the bed. I will see you early the day after the operation. We'll check your lungs and we'll show you a little bit how to move in bed or by yourself. I will also organize your brace and that will be fitted that day. The next day, the second day after the operation, I'll come early, we'll get up and we will go to the bathroom, and then by then we start losing, you know, all the drips and the catheters and everything, and we will be able to move. So I think, as a recap, remember that you want to control your pain, and you can move. You can move your legs and you can ask to be turned. So I hope this helps a little bit. I'm looking forward to meet you, and please remember to refrain from eating and drinking from 12 o'clock and no medication. I hope you have a good night's sleep, and we will be thinking of you tomorrow.